Today we are going to be talking about a very important topic which a lot of people encounter, which is female hair loss. Female hair loss is a huge problem which affects a lot of people. Overall, it affects 6% of Asians, it affects about 4% of African Americans, and up to 19% of Caucasian females. The pattern of female hair loss is more in the frontal area and the vertex of the scalp, and then in the midline area. So that is usually the pattern of a female hair loss that it usually affects. So the good news about female hair loss is usually not related to scarring, where the scalp goes to be scarred and then the hair loss cannot be restored. It's not related to inflammation, it's not related to anything which can not be reversed. So the important thing in female hair loss is that it can be reversed. The most important reason why most people are losing hair is most related to this psychosocial conditions. So that affects most of the patients, and it usually starts affecting during your adolescent lifetime, and it continues throughout the lifetime. And what it causes and results in is low self-esteem, difficulty with interpersonal relationship, and it affects your psychosocial functioning. So it's very important for females, if they're losing hair, talking to their doctor and getting it reversed as soon as possible. The second most important thing is medical reasons. That's why it's very important that we rule out any medical reason that may cause hair loss. This could be a severe illness, this could be related to pregnancy, this could also be related to medications, including hormonal replacement therapy or weight loss medications that may cause it over several months. So it is very important, if you are losing hair, that you talk to your doctor about the hair loss and see what can be done. What we usually do for hair loss is a full physical exam to figure out where the hair loss is, what kind of hair loss it is it reversible or is not reversible. What we also do is doing blood work is very important. The key to remembering in the blood work is to figure out if it is related to excessive androgen secretions. So we usually check for irregular menstrual period, facial hair, excessive milk secretion, which are all indications of excessive androgen secretion or testosterone secretion. The other thing which we also check is dihydroepiandrosterone levels, which is very important. So it is very important, if you are losing hair, talk to your doctor. Let's see what is the reason and what we can do to help you get it on control. If you are interested in learning more, please talk to us at Mediversity Health. Thank you. Have a great day.